My name is Gregory Barone. I live in Whitman, Massachusetts. I'm a cab driver, and you know, music is pretty much my big hobby. The thing about BPH is, before you realize you have it, it's very insidious because it sort of creeps up on you gradually. You start having, you know, small, like, I'm getting up a couple of times a night, to I'm getting up several times a night. And you have the difficulty of, you know, when you get there, it doesn't flow as quickly as, you know, as you would expect it to flow, considering the urge you've just had. And then you start to look around when you know, as it starts to get more severe, you start looking around for places, you know, when you're out, like, shopping, or if you're on a trip, or this or that, the first thing you need it becomes a thing that occupies your mind, where, you know, where am I going to be able to go? Every place you go, the first question is, you know, where the restrooms are at, you know, because you want to be able to be there, but you want to be able to be there, you know, without it becoming a problem.
Was there ever a time when you really felt like something you were enjoying was interrupted by your symptoms?
Well, a lot of times when I'm doing tasks, I mean, all of a sudden I'd be like doing laundry, halfway through the laundry, I'd have to run upstairs, and then I go back down there, and I feel like I got to go back upstairs again. You know, so things like that. And the other thing, of course, is, you know, the medications that they finally put me on, you know, to deal with, you know, the delay in passing that water. You know, you start out with, like, they gave me this product called terazocin, and you were taking that drug for its side effect of allowing you to pass water and to void, and because of that, as time went on and your condition worsens, you find yourself taking more and more of that. You find yourself going to higher dosages.
Would you say that BPH impacts?
Oh, absolutely, because you'd start waking up. You know, you wake up with this urge. The urge would wake you up. In normal people, when they have an urge, they get up and they know that they have to go. Well, this is like a nagging little urge. You know, it would bother you a few times a night. You know, and so, like, you don't get a complete night's sleep.
Does that bother you the next day then?
Of course, it carries over into the next day. You know, your ability to focus, you get up, you're tired. You know, that sort of thing. And then you go to work and you're a little tired. You know, and it doesn't make you as productive. It affects your productivity.
So, can you talk a little bit more about that? How the BPH symptoms might impact your job? You're being a cab driver.
Oh, well, if you're out and about, and especially if you're taking a long run, you're going to take somebody a long distance, you have to start worrying about, well, I got to go before I pick this person up. If this person gets in your cab at a train stop, all right, and then he says all of a sudden, I want to go 35 miles or 40 miles away in traffic, okay? Now it's like Panic City. You know, you start thinking about, well, am I going to make it? Am I going to have an accident? When it got to the point where, you know, I was voiding all the time, I was constantly trying to you know, get back and forth to the bathroom. My primary care physician put me on terazocin, and then connected me to urology, and that's where I met, you know, Dr. Orlando, who became my urologist, and I went on for a while with that. The terazocin did work for a while. You'd take it at night, and the next day you'd be fine, you know. But then all of a sudden, you'd find yourself earlier in the day starting to feel those symptoms interfering with your productivity. So you'd have to go to a higher dose, and so once I got to that higher dose, that's when I decided that this is probably not a long-term thing, and so I spoke to Dr. Orlando about it. And finally, he gave me some information on surgical corrections for my condition. And I looked them over, and he discussed them with me. And again, I was a little apprehensive, and that's the reason why I'm doing this right now, is because I shouldn't have been apprehensive. I should have said, let's go do this now. All right? I'm mad at myself for waiting. He explained to me at the time, about different methods, because I asked him about the tuna, and I asked him about a couple of other things, and he talked to me about the TURP and how they used the TURP, and he said, if you use that, he said you have to leave the catheter in for a while to allow it to for the post-op debris to get out. And then time went on. I postponed the decision, and then I went and I talked to him again, and I said, I think I really have to do something. It's gone too far. There's a doctor we're very lucky to have, because she specializes in this laser surgery. He said, and she's so good at it, she actually teaches it. And we're lucky to have her. He says, and with this new technology, he said, there's less bleeding, a cleaner cut. He said, if I was going to have it done myself, he said, I would probably choose this method myself. He said, though, I think you should meet with her and see what you think of this as an alternative, and perhaps we'll go with that. Then I said, well, I got to do this. Oh, night and day. I totally have my life back. I'm like a young guy. I don't have any of those problems. I don't have to worry about where the bathroom is anymore. I go and I'm good and ready. And everything is better. Everything is better. Everything works better. Everything's better. It's just no comparison. Number one, don't procrastinate. If you get a problem, address the problem. Find out if you're a good candidate for it. First two questions to your doctor is, I have this problem. What are my options? Am I a good candidate for this kind of a surgery? And then the next thing is if you do decide to have the surgery, I personally decided to leave the catheter in a few more days. The next day after the surgery, they wanted to take the catheter out. Not the urologist, but the attending doctor in the recovery room wanted to take the thing out. And I said, what happens if you take it out? He says, well, if you can't void, we have to put it back in. And I said, well, to be honest with you, I came here with the mindset that I was going to leave it in a few days to maintain the integrity of the opening and to make sure, just on the off chance that there was any debris, it would have a chance to exit. And so I did that. And the inconvenience was far outweighed by the lasting results, because when that catheter came out, which, by the way, was also painless, when they took that catheter out, I passed water right away, instantly. And when I got home, after that night, I looked down and I passed water like it just that fast, and I was empty, and I was amazed.